I'm also a consultant with IA Squared. I'm a family nurse practitioner. I have worked in the communities in California where I had been born, raised, and trained, but I'm currently here in Washington, D.C., and have worked on a number of community projects in Indian country, and am grateful to be welcomed back into this circle. And I wanted to first touch on a couple of points regarding mpox topic. Why now? With mpox ravaging the Democratic Republic of Congo, mpox still poses a health threat that has lost the general public's attention despite today's infection risks and the demand for future preparedness with global health emergencies. A brief refresher about mpox was just covered here, where mpox is an infection caused by the genus orthopox virus. Other orthopox virus species can cause human disease like variola, smallpox, vaccinia, cowpox, horsepox, camelpox, and Alaska pox viruses. The populations most affected by mpox continue to be gay, bisexual, and other men who have sex with men, as well as transgender and non-binary individuals who identify as such, with a disproportionate number of cases among African American, Hispanic, and Latino men. But what about our American Indian, Alaska Native folks identifying as TS LGBTQ? When AIAN were mentioned with mpox vaccination efforts, one university had been quoted as the shortfall mpox vaccination was largest among non-Hispanic African Americans, 77.9%, and non-Hispanic American Indian or Alaska Native, which was 74.5% persons. This analysis shows that based on this disproportionate number of cases, that 66% that were vaccine eligible continued to remain unvaccinated. And this was quoted back in June 2023, when AIAN are referenced as not counted or not reported or categorized as other race. This data genocide relies upon data collection and reporting standards that consistently leave a gap in the understanding of the impact of mpox and mpox vaccination outreach in American Indian and Alaska Native communities. Prioritizing this collection of race and ethnicity data, Native voices needed to stop the community spread of mpox, beginning with Indigenous researchers and community practitioners like Nathania Desoisi and Dr. Fabian here. I just wanted to highlight with Nathania Desoisi, she gives her regards to the community here. She wishes that she could be here to share her perspective as a health planner, but with a family emergency, she regrettably could not attend. And we're so grateful for the insights and expertise that Dr. Fabian has. And I'm going to give a background introduction to the organization that he represents, and then also a speaker's bio as well. And so Dr. Fabian is the executive director for BAAITS, the Bay Area American Indian Two Spirit organization. The missing statement here is that the organization exists to restore and recover the role of Two Spirit people within the American Indian and First Nations community by creating a forum for the spiritual, cultural, and artistic expression of Two Spirit people. And I wanted to highlight, which Dr. Fabian left out, but I wanted to make sure everyone here heard in the audience that the organization BAAITS had been recognized for the past 25 years in 2024 for all of its work in the community. So I really want to highlight that. And then specifically, Dr. Fabian's bio is where they identify as he, she, or they, and in ceremonial spaces known as the butterfly of light. And I'll have to have Dr. Fabian make the pronunciation correctly. But as the current executive director of BAAITS, they are a person in recovery, an immigrant, and a curanderos. Two Spirit Queer, Ben, and Zapotex, manager, administrator, clinician, and cultural bearer. Their life experience has enabled them to connect, advocate with, for, uplift, and celebrate community members from all walks of life. Professionally, they possess a 25-plus-year history of progressive direct, social, and clinical service, administration, supervision, management, community organizing, advocacy, and policy experience across a range of settings, including foundations, community-based organizations, community health centers, public health departments, grassroots organizations, and community collectives. Angel holds a BA in human biology from Stanford University, a master's in nonprofit administration from the University of San Francisco, and a doctorate in medicine from the Universidad Autónoma de Guadalajara. For the past 20 years, connected to their journey in recovery, Angel has been able to reconnect and become an active member of their indigenous communities, Benza, Zapotec, and Mexchica. I also wanted to highlight the individual awards for Dr. Fabian. 2023 Changemaker Award from Stanford University, Native American Cultural Center, and specifically their Center for Equity, Community, and Leadership. And also just recently, a few weeks ago, the 2024 Transgender Day of Visibility, the Champion of Change Award. And so I really want to welcome to this virtual stage, Dr. Fabian. We are so honored to have you in this space. I want to give you a little bit of time to introduce yourself and to share anything that might have been missing in the bio before we enter into conversation. So I'll hand it over to Dr. Fabian now before we go into questions. Go ahead, Dr. Fabian. Thank you.
Is there a possibility to stop sharing the screen? Yes, thank you so much. Wonderful. Welcome everyone. And in my tradition, let me introduce myself. Yahweh, Yahweh, Yahweh. Nidala Ángel Constantino Fabian Vera, Nidala Tlawis Papalot. And grateful to be sharing virtual space with folks who have joined us from the traditional lands, the unceded territory of the Ramaytush Ohlone here in the San Francisco Bay Area, who are still living, thriving, and working to ensure that their story and their journey does not get forgotten here in this area. Thank you so much for the introduction, Karen. The pronunciation is Tlawis Papalot, and Tlawis Papalot translates to butterfly of light, and that is how I'm known in ceremonial spaces, which I'm very grateful to be connected to as well. Just a disclaimer in terms of my participation in this particular seminar or webinar is that BAAITS, the Bay Area American Indian Two Spirits, we currently do not receive any sexual health funding from neither city, state, federal, or private foundations. Although we have worked in collaboration with one of our sister organizations, the Native American Health Center, around HIV prevention work earlier in our story, organizational story, we currently do not receive any. So my contribution to this conversation around mpox is much more of a lived one, and also based on previous experience, clinical and community advocacy experience, as we were seeing COVID and transition from COVID to mpox in community, and what was the response here in the Bay Area. So just want to start with that and hand it over to Karen to continue. Yeah.
Thank you, Dr. Fabian. And I wanted to touch on just from what Dr. Fabian was talking about in centering in community, the perspective of community as to what was the actual voice that was given to community when the topic of mpox came up. Before we even get to the topic of mpox vaccination. And so when I think about that, then I realize that as a clinician myself, if there isn't sufficient voice, if there isn't sufficient information, data out there, we can definitely run into the problem of thinking it's not a problem. Then we're not making the appropriate diagnosis because we don't think it's out there for a community. And then with that incorrect diagnosis, we have a delay, we have inappropriate treatments. And so I want to center us back in community voice, where who has control of that information? How can we rectify this data genocide? And Dr. Fabian had shared with me what he had learned in the community, his ear to the ground, and their perspective that they will share with us now. I want to make sure is highlighted. Go ahead, Dr. Fabian. Thank you.
You're welcome. And so even centering it further in terms of Two Spirit community, Indigenous queer community, and LGBT by POC community as a whole. Because the phenomenon of access or lack of access was very visible through two pandemics here in the Bay Area. In the Bay Area, mind you, we are known, the San Francisco Bay Area, which encompasses around 7 counties, but some of those counties are much more resourced than others. Um, and even in those highly resourced counties, such as San Francisco, um, there was a lot of just the public health infrastructure was not ready, was not prepared to respond to COVID and its disproportionate impact in community. And by default, they were not prepared to respond to mpox and its disproportionate impact in community. Um, I'll make reference to from a clinical in my part in as part of a clinical team when mpox came about. I was part of a clinical team of a local community health center before coming on board to BAAITS. And unfortunately, what had occurred there is that a lot of folks, specifically if they were trans identified, um, and they ended up in the emergency room. Many emergency rooms were not prepared, honestly, to receive community members from pretty marginalized communities. Um, I'm talking specifically around sex working communities, houseless communities, drug using communities that would, because of um, what they needed to do to make a living or just exist in the world, um, were getting exposed to mpox much more than other communities that we're seeing. So they were being they were trying to access services at the emergency rooms, and then they were being kicked back to community clinics that were experienced working with those populations. In in that process, many of them were did not come back to us or did not access us, did not get the timely treatment that they needed to be able to at least alleviate some of the excruciating pain caused by mpox. and then access the needed vaccination to prevent it in the future. So that's one example, just one concrete example of what we saw in clinic. The other example that is much more community-based was the response that was taken by the larger Anglo-Saxon community, specifically the gay and bisexual community, with regards to access to vaccination. The first place, or one of the first places that was offered to have vaccination available to community was at our local bathhouse. And our local bathhouse is a pretty expensive bathhouse. And, just like, during COVID, during mpox, folks still have sexual needs and where they were taking care of their sexual needs. So these establishments, they closed a little bit for COVID, but afterwards they were pretty open. But the access piece was that once the vaccine became available, you needed to pay a fee to get into the establishment, then be able to access the vaccine. And it was only made available during working hours. Fortunately, Black, Indigenous, and people of color community advocates responded to both the San Francisco Health Department and the Alameda Health Department, and I think the Berkeley Health Department was involved in that, and asked them why. Asked the question, why is this access so not accessible to community members who are working or working poor, who could not take time off to stand in long lines to be able to access, and then have to pay a fee to be able to then access the vaccination. And we're loud enough and diligent enough to have access become much more expansive. But it took gosh, it took almost 6 months before the vaccine was available to it being accessible to communities who were overly impacted by the vaccine, by mpox, and then have funds available to be able to develop educational campaigns that spoke to community members, that was in their language, that featured them in images, and that strayed away from some of our learned lessons in HIV. Just for the audience, most of my paid work has been in HIV. And I have seen the different ways of the HIV prevention treatment campaigns have gone from scare tactics all the way to living a manageable disease, all the way to making sure and connecting to sexual health and not demonizing sexual health or not making it shameful, and celebrating sexuality in a healthy way. So before these resources were made available to community, to be able to develop these campaigns, there was a time lapse almost a year. And so it's not surprising that and I was sharing this earlier, Karen, with folks. It's not surprising that the over impact of HIV, the over impact of syphilis, the over impact of mpox is hitting community in a way it has, because there's a lag of response. There's always, it's always reactionary to an outbreak rather than preventative. The last thing that I'll mention before opening it up to the group is that as clinicians, and especially as And if you have the ear of your medical directors or your nurse practitioners or even your medical assistants, having an ally, and more than an ally, an advocate in those spaces is super, super important. Because then it allows, or at least um, there can be an immediate response to folks coming in and posing all sorts of situations that may expose them to mpox, or re-expose them, because now there's folks who have been vaccinated who are getting re-exposed, and and facilitate them getting the treatment that they may need, getting the vaccination that they may need, and or connecting them to other services, because mpox is not it's not an isolated disease. It's not an isolated virus. Um, and also, and I think especially with Indigenous communities, is how do we begin the conversations of um, naming the sacredness that exists uh, as sexual beings. And because our sexuality is sacred and our relationships are sacred, how do we honor that in the way we talk about sex and sexuality in Indigenous communities? So I'll stop there because I can be, I can go on forever.
I love each of the points that you bring up, and just recalibrating, taking centuries step back as to the essence of who we are, and particularly in this conversation, we can't get all the way to point Z without talking about point A. Point A about the sacredness of our sexuality here. Before we even get to mpox vaccination, what can you share with us as to how medicine can be reorganized as a space where it's first creating sacredness around the beauty of sexuality, sexual positivity, the healthiness of relating as individuals in sacred relationships, making sure that our sexual needs are being met. I wanted to make sure and reflect back some of those highlights that Dr. Fabian had brought up. And one, regarding the insufficient information and how that data genocide has contributed to inaccessible access that ends up canceling each other out for what should have been the purpose of health services to be made available and to be utilized. But that wasn't true because we didn't have the information to properly identify this as a problem, to ensure that services are patient-centered, that when people are working, that's not when you can make only available that service, that vaccination product, that making a fee be a requirement. It's not possible when already marginalized communities can't afford some of the most basic needs. And as a public health threat that has a ripple effect, the revisiting of this fee would be a question not just for our immediate organization that we serve and the community that we serve, but at a greater extent, the larger community as a whole. And then for the indigenization of imagery, such that there's a sense of feeling comfortable to access those services. If we could have sanctuary cities, for example, where we felt comfortable and not threatened to get the services that we need for survival, really, where mpox vaccination can help prevent severity of disease and/or death. And so those were just but a few of the many points that were highlighted here by Dr. Fabian. Thank you.
You're welcome. Something that I did do because I wanted to do due diligence and honor the work that is happening in across Turtle Island with community-based organizations that are doing sexual health work with the Two Spirit and the Indigenous communities. I did reach out to some colleagues in Canada. Now, as some of you may know, BAAITS usually has the Two Spirit powwow, and we are the first, one of the first public open Two Spirit powwows in the nation, and have grown exponentially. And in February, for example, this year, we held our 13th annual, and we had close to 5,000 of our closest relatives come and join us here in San Francisco for some for a week, some for the weekend. And we are assuming that folks came here to play as well, you know, not only attend, but also connect in multiple ways to other community members. So I'm mentioning that particular gathering because I think those are the spaces that the different societies, the different Two Spirit societies are creating and are critical in terms of including these types of conversations, these types of talking circles, these types of information sharing and resource sharing, to be able to access community that they may not feel comfortable going to a clinic, may not feel comfortable going to a community center. Um, and so I reached out to get back onto track to an organization, CBRC, and they have a specific Two Spirit program, and they're based out of Vancouver. And so they are currently running an mpox study, but it's in very early stages to be able to share any information with the audience. But they also mentioned that there's a current outbreak in Toronto. I mentioned the outbreaks because similar to a gathering that I attended last year, Circles of Harmony in Albuquerque. Um, at that particular conference, they were highlighting an outbreak of syphilis that was happening specifically around Two Spirit and inclusive of trans-identified Two Spirit community members. And it was mostly in the Midwest, that the outbreaks were happening. And we know that our community travels and our community goes to powwows. Our community goes to gatherings. Our community comes to San Francisco for the BAAITS powwow. And so we were kind of getting ready to encounter that that those spikes. And so I think we even if that's not where our funding comes from, we should always be in tune where the different outbreaks are happening and how our community members travel, whether it is to work, to live, or to play. And those are really important, that even if they do not have a zip code for our particular region, that they are within our community. And if they need access to those services, let's hopefully provide them access to them. What they did share was that they are currently doing what folks or community organizations that are in tune with community needs, is that they're bringing the services to community. They're not expecting the community to come to them. Rather, they're going to and offering vaccinations at different gatherings, at different community events, and engaging in those conversations around what does it mean to be sexual, period. What imagery represents that. Um, and and have very open discussions about how folks meet that need, whether it's for monetary reasons, which several folks, not everyone, but several folks, based on COVID, lost employment and they needed something to generate income. And at least I believe sex work is work, and they started engaging in sex work, as well as folks just had needs and needed to connect sexually with other folks, and through whether it was through the applications or whether it was through the cruising spots, folks were connecting and having sex, and hopefully they were having good sex, and enjoyable and fulfilling sex. And at the same time, there was that risk. There was I don't like the risk language, but there was mpox was still there, syphilis was still there, HIV was still there, and so um, instead of how does taking care of our sexual health just become normalized, and if need be, accessible, that there's wraparound services, that you're not only getting an HIV test, but you're also getting, tested for STIs and offered vaccinations if they're available. And treatment if you are, and I think this also ties into some of the efforts around PrEP and making PrEP available and accessible to community members. We are, and right now, the organization is our home base is in the San Francisco Bay Area, and there's a lot of resources here in San Francisco. I can only imagine what Two Spirit community is facing in spaces where it's not that available, where there's not societies, where there are not programs, and where still there's a lot of shame involved with the identity.
Thank you, Dr. Fabian. And I'm wondering, Dr. Fabian, from your expertise, from your change making, how you found that stamina in creating that very special place, that highlighting of the sacredness of our sexuality, yet in these times of change and challenge like COVID, then to mpox, but at the center of it all, it's this insufficient information, both of the larger community in Indian country, but then also specifically the needs, the rights of TS LGBTQ individuals. So thank you again for sharing. And Dr. Fabian, what thoughts might you have? What suggestions might you have?
Um, Thank you for the question, and I think my experience has been as I started as a community health outreach worker in the early 90s doing HIV work. And at that point, we were everything to everyone because there were so few of us in community doing the work. And for those of us who have maintained um, that trajectory and are still sane or are still alive, because the reality back then was that, many folks transitioned, and are now with their elders. And so I think that uh, as an individual, it has been a lot of in order to be consistent, I've also have had to take care of myself, and have had to journey into seeking the help that I am so willing to provide to community. I want to make sure that I'm seeking those same resources, and I am walking the path in a good way, and being consistent in that respect. And so I self-care, although it's not self-care from an Indigenous perspective, looks a lot like connecting to community, connecting to ceremony, connecting to um, undoing or reimagining one's future, um, from historical trauma, from coping skills that we were passed down from generations and generations. And so I think that holds true, and I know that culture is medicine, and being able to access those spaces. And I think I go back to why it makes sense, for example, at a Two Spirit gathering or a Two Spirit anything, that there's so many intersections and there's so many things that can happen and should happen at those, that it's important that as much as we have um, sweat lodge or temazcal, we should also be having those conversations around our sexual health. And they should not be, and there's space for that. And we can create those types of spaces for that. So that, it just becomes second nature, that all your multiplicities that we come into community with are addressed in a good way. Um, you know, the interconnectedness, for example, what we are learning from community is that, especially because we work a lot with artists and culture bearers in community, is that the level of income insecurity, the level of houselessness, the level of unemployment, the level of food insecurity is extremely high in community, especially living in an area as expensive as the Bay Area. So if all of those things are taking priority, of course the sexual health piece is not going to make any sense, because you're trying to make ends meet. Your priorities are somewhere else. Um, and and you may not go in for a checkup, or you may not go in for unless it's made readily available to you. And so I think that um, that take care of yourself, heal, and always check in with community, because community is going to let you know what's working and what it's not, and how to make these services accessible for them. And for clinicians is be open to that. I know that working in hospitals and working in clinics, there's other priorities that sometimes take place. There's, unfortunately, the healthcare system is pretty intense and unforgiving to change, especially. And so know what is available and what, changes can be made to be able to accommodate these changing needs in community.
Thank you, Dr. Fabian. And so I think everyone has that place to communicate the voice, but I think you also have brought up several points too that I'm curious what Dr. Fabian's response might be, where we're coming from just waves and resurgences and an ongoing undercurrent of COVID, resurgence of syphilis. I'd seen that just in my short 20-year career of coming and going, coming and going. Now it's coming back. But a question to you both that is across location, but how do we reframe public health professionals that are not Indigenous to hear each of your respective voices, where it isn't that a direct message just only about mpox vaccination is going to land effectively or at all, because the community's voice has been ignored from the very beginning. And so coming back to centering of community here, where do each of us play a role? How do we reframe public health professionals in their approach, in their focus area? And maybe Dr. Fabian, if based on your experience and the successes from BAAITS' 25-year history, how can we be better at doing the work that needs to be done? How can we be better allies for those who are not Indigenous?
So I'm trying to understand the question. I think so. One of our assets has been consistency. So even as a predominantly volunteer-run organization, we have been around for 25 years. And we've been consistent, at least, showing up at the San Francisco Pride Parade and hosting the Two Spirit powwow. And so community knows that there will always be a safe space or place that we tend to create. So being consistent is super important, especially gaining the trust of community. I think for being less reactionary and more proactive, I think that I would encourage maybe not even going to public health, but starting with Indian Health Services, or starting with the community health clinics, which there's a network throughout the US. I would start there because in terms of access, I think those access points are easier for community than public health. And so I would start there and having those conversations with Indian Health Services, and having them developing those campaigns and developing that information, or developing those programs that are feasible to do wraparound services, to be able to again be less reactionary. And for example, we have here in San Francisco, we have Strut, and Strut is specifically on sexual health. They don't do anything else but sexual health, and male presenting or male identified community members from all sorts of races, can go in there and get their PrEP, get their mpox vaccines, um, get their what is it? It's not PrEP, but is doxy PrEP. They can get screened for STIs, everything, you name it, and if they need, Hep C testing, they can get it there, and then they can get referred to other spaces if they need other services. That is unheard of. Maybe it happens in New York, maybe it happens in Chicago, maybe there's some spaces in Los Angeles, but having that type of wraparound services would be amazing to have in a rural clinic, or in one of the clinics that Indian Health Services runs. Could you imagine? Could you imagine having something in, and maybe it exists in Oklahoma. I don't know, but to have something in Oklahoma, to have something in Kansas, to have something in New Mexico, with that type of mentality for Indigenous community members. Wow, how great would that be? And that also includes or wraps around, some of the cultural needs of being connected to ceremony, being connected to teachings, being connected to elders and to youth. That would be amazing. So yeah, so the potential is there. I think it's just how far are we willing to dream and to think beyond, what public health looks like currently, or what clinics currently look like. Yeah, I'm a little bit of a medical anthropologist myself, and I appreciate when folks talk about wellness in a much broader sense.
Thank you, Dr. Fabian. Jamie, go ahead.
I have a quick question. So, interestingly enough, we're seeing that mpox is making its way back into the news. I actually just saw something come across yesterday that mpox rates are twice as high. I have I don't want to mess up the quote, but as of yesterday, mpox cases in the United States are twice as high as they were at this time last year. And so, just for folks maybe out there that recognize that this is an important issue that needs to be raised, how do you have any recommendations on how they can kind of bring this to their leadership and really see this for their leadership to see this as a priority and invest, whether it's human resources, folks' time, or marketing resources to put information out there? Do you have any recommendations on how folks can kind of get that message to their leadership and work to prioritize this if it's necessary in their community?
What seems to be working for us is to take a step back from the disease and go back to the individual. And especially in communities that have been over impacted by colonization and have forgotten the Two Spirit or Indigenous queer community members and their role and function in the larger community. I think I would start there. I would start with that conversation first, to then open it up to, okay, so this is what our cultural teachings say about Two Spirit community members. And there's some really unfortunately, ingrained teachings that happen um, through relocation, through indoctrination, through um, the boarding schools, through you name it, it just got reinforced and forgotten. Um, and then if folks are willing to engage and talk further, then I would bring up some of the challenges that the community is facing, including this one, but not start with mpox, because mpox is part um, of a bigger challenge. And so we know that, uh, and we're doing an assessment right now, or beginning to plan for an assessment, community needs and assets assessment. And we know that in literature is that if you have family acceptance or community acceptance, the rates of suicide decrease substantially for Two-Spirit community members, specifically Two-Spirit youth. And we the cohort that's helping us with this assessment named something that was very poignant. It's not only acceptance, but it's, do you feel safe with your family and your community? Because if you don't feel safe, that's a huge barrier. It kind of reinforces the need for folks to create their own uh, community and family and chosen families, to be able to make it through the world, or to make it through adulthood. Just talking again about young people. I think that there are issues that and how does that impact whether or not I'm taking care of my sexual health? If folks are telling me that you shouldn't exist, why am I going to take care of anything? And so I think that there is a way to be able to engage elders, councils. There's a way to engage, but it has to start with taking a look at what, how are you viewing, or how are you embracing or not, Two-Spirit and indigenous queer community. Because if you're not, then it's going to be really tough for folks to make it through. Um, and I would, if appropriate, I would hold leadership accountable, because that's just part of their community. I keep repeating time and time again that the circle was never complete without us. It has never been complete without us. And so how do we complete the circle and continue taking care of one another? And I'll stop there, and because again, she can go in forever.
And in that inspiration, I also give Dr. Fabian some time to share any other last items before we wrap up here. Thank you, Dr. Fabian.
Thank you again for the invitation. And as I transition to Yelder status, as some folks have mentioned it to me, I know that a lot of the teachings have been from folks that are no longer with us, and a lot of the advocacy is from them as well. And so I think that the newer generations are holding us accountable, to reimagine what wellness is and what sexual health is. So I would encourage folks to also connect with the younger generations that are trendsetters, that are being trendsetters right now in terms of just how openly and how freely they speak about themselves as Two Spirit community members and themselves as spiritual beings and themselves as sexual beings. And all of that wrapped around in the sacredness of self. So self and community. So it's really beautiful to see this happen. And lo and behold, unfortunately, there's going to be other viruses that are going to be challenging us and community. Um, but I think it's up to us of what have we learned from the work? What have we learned? What can we continue learning from community? And how can we maximize the resources that are available to us to be able to uh, really make some impact in community? So I wish everyone a long and steady journey in this work, because we need that longevity, and it doesn't change overnight. I've been in the sexual health world since the early 90s, and I still cringe on some of what I see coming out of public health, and understand that the way that we learn public health, or that we learn in clinic, is antiquated, and does not reflect the fluidity of community, and so that's where we get to step in, um, and um, and fill in those gaps and fill in those holes. So I'm truly grateful and honored to be part of these discussions, and also to continue being a resource in my limited capacity